hospitals. They brought the hospitals under compliance, and then they went with the larger practices. Well, now they're down to the small mom and pop practices where everybody, so that every provider in the country is now expected to be in compliance. In the past, most offices had a HIPAA manual. I mean, you pretty well had to have the HIPAA manual for the last 12, 13 years. But some offices did have operating procedure manuals, although many had the old employee handbook type. Well, things have changed with that as well. Things have changed in the human resources area, what we have to do in our practice. The whole idea of compliance is basically something new we're having to bring in. The safety manuals, now, they're even more important than they used to be because of some of the things that President Obama has done with directing all of the agencies to work together. So now basically you really need to have all of these different parts in place so when they walk into your office, and I've talked to different people that have had these type of audits, they walk in, one of the first things they ask for is your operating procedure manual and your HIPAA manual. They want to see that you've got all of this already in writing.
So Dr. Cross, what I'm hearing you say is that if I have my office manual of procedures that we've had for the past forever and the HIPAA manual that I put in place 10 years ago, that I'm good?
No. You're a long ways from hanging yourself out to dry, but you do need to do some changes. There's been a lot of changes that happened in 2013 with the upgrades to HiTech and to HIPAA, and brought in new regulations, increased fines, and things like that. So that's what we're seeing is a lot of the offices are still working with the operating procedure manuals they had previous to that. Well, now there's a lot of new requirements, and we're going to be talking mostly about those today.
Actually, you talked about high tech, and this is something that I know was surprising to me when I first heard high tech. I thought that meant it's like, oh, now that we have computers, high tech means something, right?
Oh yeah, high tech not only means computers, but it's also all the security. It's the way we have our antiviruses set up. It's about how we have firewalls set up, how we protect our Wi-Fi, and there's lots of different things in that under the high-tech regulations. So let's get back to the basics here. You must now have written policies and procedures. The OIG and CMS and their different training things that they've released, they all want a written and a formal manner. They want these very, very concise. They want to make sure that there's no question about who's responsible for what. They want to make sure that everybody knows the exact processes that has to be done, what the procedures are to do that, and they want to make sure that everybody knows who's responsible for what. So this really takes, making our HR manuals a lot more detailed with making sure you've got good job descriptions and that you've got your things set up such as, chain of command, things like that. So we're going to go through just a quick overview of all of the elements, and then we're going to, in red, you'll see the ones that we're really going to focus in on today. So everybody should have a compliance officer already appointed. It should be in writing, and their duties should be already spelled out for them. They're going to have to review all of your policies on an annual basis and document that they did that. And then, of course, you've got to establish several different logs, with log of inquiries being the most serious. We're going to talk more about that in a little bit. The compliance training and documentation training. Now, this is one of the things I want to bring forth for the doctors. This is not just for your staff. Even if you're a solo doctor working with your wife and maybe a CA, you are mandated to have training for yourself as well as for your staff. And please, please make sure you document this. We've seen incidents after incidents where the fines were just, incredibly high because there was no paper trail. There was no documentation that the doctor had trained his staff, things like that. These lines of communications, they want to make sure that everybody in the operation knows exactly who to report to, who's responsible for what. So again, it has to be something that's in writing. Of course, we have to do the self-audits and corrective action plans and record retentions. We're not going to talk much about that today. Kickbacks and inducements, though, those are something that I didn't think about in my little practice that I really had to worry about. I knew I was practicing what I thought under the law, but once I started digging into some of these laws and really figuring out what they actually meant, I found out that I was doing kickbacks. I was actually giving free care to my medical colleagues in the area. That's a kickback. Just my giving free care to one of the medical doctors in our area that could refer to me is considered a kickback. And inducements, that's a big thing that the CMS people are jumping on with Medicare. You know, you cannot give a Medicare patient anything worth more than $50 per year. And they really don't want anything more than $10 per incident. So, you know, if you forgive them a examination charge that's normally $65, that's an inducement. And there are huge fines for that. So these are things we've really got to make sure we train everybody in the office on, the doctor, as well as the office manager and the staff, so that, you know, even things that we would not even think about, like I said, you know, I've been treating my medical friends in the area for free forever, but that's a kickback, so we've had to stop.
And one point that I'd like to make over here is, Dr. Cross, when we first started talking about this, I got to tell you, I thought that some of the talk about this was hyperbole, and it's like, as I said today, the comment from today's paper about some of the changes that they're planning now for 2018, and what we talked about before about some of the new instruction by the government to have agencies working together. Um, some of the kickback that I've heard, the penalties when you say they're huge, you've told me that they're like how much money?
A lot of these started at $150,000 each.
And the point that I want to make is you can't afford to not have some kind of a awareness of this stuff because the world is different. You can do it yourself if you want to, but you need to have some kind of a system so that if someone knocks on the door, you can in good faith say, hey, I've looked at everything that I'm responsible for and I take care of things.
Right. I mean, and that's really playing a big part of when we're seeing these audits going down. If the doctor is really trying, if the doctor has put policies and procedures in place and is training the staff, the fines have been much, much lower. But if there's been nothing done, they at this point they say everybody should know what they're expected to be doing, and so if you're not doing it, they consider that purposeful non-compliance, and the initial fine for that is $150,000. You know, 10 years ago, if you had a problem, you said, well, I didn't really realize I was covered by that, they might cut you some slack. Not anymore. Now they actually have a fine specifically for you when you say that. So they expect us to know what we're required to do. And they're really starting to make some examples of doctors. We're going to talk about that shortly. Disciplinary guidelines. This is something else that must apply to the doctor owner. There is nobody in the office that is exempt from disciplinary guidelines according to what CMS expects of all of the providers. So even the doctor is covered by these disciplinary guidelines. Documentation, we do seminar after seminar on documentation. I'm not going to get into that today really, except for some of the logs. Make sure that you've got guidelines for each payer type and in writing. Again, this is part of the compliance with billing procedures and things like that. You must have your procedures in place for your government reporting when you have a breach or you suspect a breach, that type of thing. All those things are part of this compliance program that the OIG has put out. And one of the things that it really focuses on is making sure that we have an atmosphere of ethical compliance within the office. And they say one of the main things that we need to do is have a standards of conduct that has to be written. And this is a quote, that clearly state the contractor, that's us, commitment to comply with all applicable statutory, regulatory, and Medicare program requirements. Now, this is not just the Medicare requirements. Remember, they put the statutory in there and the regulatory, meaning all the regulations that has to do with billing, you know, that and all the Stark laws and all these different things and kickbacks. You know, they are looking at all of these different parts. And the standards of conduct should be something that you express to your staff, you train your staff on, so that if they walk in and they talk to your staff, they can determine that you've actually worked at establishing that atmosphere within your office. There's more details that we're going to talk about in a moment. So it's not all bad. I'm sure you've heard about all the frivolous lawsuits. America's got the worst problem with frivolous lawsuits of any developed country in the world. It's amazing what I think it's like 5% of our GDP goes towards just frivolous lawsuits. Well, if you've got really well-written policies and procedures, it protects you against those. Some of the other seminars that I give, I talk about some of the examples that I've seen where doctors that did not have a good set of written policies and procedures were sued, and they didn't have anything to protect themselves or defend themselves with. So if you've got good procedures and policies, it defines what's going on in your office. It also helps protect you against lawsuits. It also, it limits responsibilities as well, so that it's very clear for an outside person looking in that your billing CA just does the billing and doesn't have access to some of the other things patient-wise that she shouldn't have. They want to have those designated responsibilities for information as well as for the billing procedures and things like that. So it's not all bad. Having good policies and procedures should help you improve your bottom line as well because of a lot of different things that it eliminates, cuts down your denied claims, things like that. But we're specifically talking about training today, and we'll get back to that now. So your training has to include the doctor. I go in and do training in doctors' offices, and sometimes the doctors just don't show up. Well, the training's there for the staff, and they just, well, I don't think I want to sit there, so they leave. Well, that does not fly according to what the CMS wants. They want everybody, including the doctor, to receive the training, especially on security issues. And they want our new staff, whenever you bring somebody on board, to have their security training the first day of employment. I walked into an office where I was expecting to find to be very well in compliance. I knew that, I'd talked with him about his policies and his procedures, and I was expecting to find that he had a really, really tight ship. What I found out, though, was that they provided training on HIPAA and security once a year, every January. Well, anybody that was hired after January had no training security, no training on compliance until the following year. So NIST, the organization that in Washington that develops a lot of these guidelines for electronics training and all, said, this should be done the first day of employment. You want your staff to know, what they can and can't do on your computers, that, they're not to be logging into Facebook, that they're not to be doing things like that on your office computers. And the only way you can make sure you do that is train them their first day. And so that whole idea of creating that atmosphere starts on their first day of employment. And documenting these things is very important. You really need to have attestations in your staff's files saying that they've been trained and saying that they understand the office's code of conduct. You have to create these paper trails. We've seen in several different audits where there was no paper trail, wasn't done. And if the operation had just simply had a paper trail, they would have avoided thousands and thousands of dollars in fines, but because they didn't have a paper trail, they got hit with these huge fines. So document everything. Anti-abuse and anti-fraud policies. Again, this is something, it's all part of that ethical, compliant office. They want to make sure that there are policies in place so that your CA feels comfortable with bringing to whoever their supervisor is or to the doctor's attention that they feel there's a problem, that they feel very confident that there will not be retaliation if they bring this up. Even in a small office where there's just a doctor, let's say 3 staff, you still must have a whistleblower protection policy so that if somebody does see something going wrong and they report it, there's no retaliation on that person. So it has to be in writing, and that's something they really look at because they want to encourage people to report any type of problem. And so they see that having a clear chain of command and a whistleblower policy really protects the employee that brings up the fact that there's something wrong being done in this office. Coding should be done to the most accurate level possible. Chiropractors have a terrible record of down coding. And CMS sees down coding as just as bad as up coding. The medical doctors have a reputation for up coding. We have a reputation for down coding. Well, they want things coded to the most accurate. And by doing that, it actually increases your bottom line because most of the time we don't code up to the code that we should be, which of course increases your reimbursement. So, the most accurate you can do, the better your bottom line. When you're setting up your policies for these audits and these reviews, again, you need to be specific on who is responsible for what, who reviews your claims on a regular basis, and then who goes in every 6 months or so and does a spot check, does a self-audit to make sure everything's being done that should be. Who performs those internal audits? Is that going to be your compliance officer? Is that going to be the office manager? All that needs to be in writing, and there should be specific directions on how often these audits are done. And then if there is a possible breach, who's responsible for following up to see if there is? Who's responsible then for reporting it? And you should have policies in place on who you report it to at what levels. So all this has to be done in such a way that you train your whole staff so they know who is responsible for what, and so that they feel comfortable bringing it to your attention if you're the doctor that there is something going on that's not correct. I hear from young students when they're just graduating and working as associates that they find something wrong, that somebody, the doctor that they're working for is doing something that's a little shady or could be completely illegal. And basically when they bring it to the doctor's attention, the doctor says, hey, it's my way or the highway. Well, that is what this type of policy is set up to prevent. You're supposed to be doing things correctly, and you're supposed to be encouraging all this in your office, but if you're doing something illegal and somebody brings it to your attention, they're actually covered by those whistleblower laws. And, so you could, a doctor doing something incorrectly or actually illegally could really, really get in a lot of federal trouble with some of these whistleblower laws if they try to retaliate against an employee. Specific training for the doctor, again, a lot of doctors, and I didn't either until I really looked into it, didn't understand the kickbacks and the kickback laws, didn't understand the inducements. And I run into offices doing inducements all the time. To me, personally, helping out a Medicare person, that's who we need to help out. The elderly, they're on fixed incomes. We should be able to help them as much as we can. But unfortunately, the federal laws state that we can't give them care. That's an inducement. It just doesn't make sense for me personally, but that's what the federal law says. We cannot give them care. Demonstrating medical necessity, that's one of the fraud laws that they're using against us. If your documentation doesn't show that there's medical necessity, then and you're billing for it, then you're committing fraud, because you can only bill for something that is medically necessary. So they're really using some of these little things like that to really run up the fines on some of the doctors that they're auditing. So please make sure you know all of these things, and you're training your staff, you're training your associates, that all the doctors know exactly what is required. Standards of care, same thing. What information is required on your treatment notes? All things that we have to get more and more training on to be up to snuff. Operations logs, we've always had some in the past. Now there's over 10 different logs that we have to have in our offices. And again, it's just creating a good paper trail, whether it's on the staff training, individual training, your safety training, your safety review, all kinds of different logs that we have to document on a regular basis. The inquiry log is probably one of the biggest that we need to be paying more attention to than any of the others, because anytime you get a records request, it should be put in that inquiry log. And that way you don't lose track of records request. And I'll give you an example why. There was a doctor in California and received 2 records requests from Medicare for 2 days of service, all right? And so he got the second letter, he did not respond to the second letter, and CMS Medicare threw a full-blown audit at him. They went in, and when they were finished with him, And this was just a single doc office. He had over $800,000 in fines. And in their newsletter where they were talking about this, they said they basically made an example of him to show that if they want to, they can come in and they find so many things wrong that they basically, like I said, $800,000 in fines. So, you've got to pay attention to those records requests. In their newsletter, they said that in the future, they will consider not responding to your second request for records as purposeful noncompliance. Well, purposeful noncompliance is one of those new regulations that has a minimum fine of $150,000. Now, it can go up to $1.5 million just for that one particular thing. So they made an example of this doctor. They're saying in their newsletters that they're serious about this. They want us to become compliant, and this is what they're doing to make an example of one of our doctors. So back to the training. Lots of training to log. You need to log your compliance stuff, your medical information transmission. Another one that they really look for when they come in. Anytime that your protected health information is faxed or emailed out, you must log it. Now, of course, anytime you send it out by email, it has to be encrypted. So when you put together your log for that, you need to make sure that it shows that the email was encrypted when it was sent out. Faxes, so far, we don't have to encrypt, but emails we do. Now, in our office, just to be more CYA, I'm covering my, I have in my logs whether we mail it. I want to be able to demonstrate to an auditor that I either faxed it, I emailed it, or I mailed it. I can show exactly what was sent out of my office and in what manner it was sent out. So this way, I'm protected. I'm just trying to create that paper trail to protect my assets. Let's see. Peer disciplinary procedures. They want to see that if the doctor does something wrong, screws up, causes a breach, that even the doctor that owns the practice has disciplinary procedures that take him into consideration, and there are procedures, placed against the doctor himself. Now, that might be just receiving more training, but it has to be in writing that the doctor screws up, he has to do something because of that. And there should be a corrective action plan in writing whenever there's a problem, and they want to see that it's applied consistently to all staff. So, you need to train your staff on these things as well so that everybody knows what's expected. When you're writing your policies and procedures now, they want them very, very clear. This is a formal format here, and this is what stands up in court. When you're writing your policies and procedures, you need to write them with the idea that at some point they may be shown on an overhead in court. So you want to make sure that they're very well written, they have a title, they have a date that you approve them or whoever approves them, the date they were adopted, and you have a written policy in a full sentence, and your procedure, again, in full sentences. So that this type of a format does stand up in court. But if you just have the old employee handbook type where these things don't exist, it does not stand up in court, and it's not sufficient for what CMS is looking for now. So in review, develop your code of conduct, train your staff to establish that atmosphere of compliance, write policies and procedures to prevent the fraud and billing abuses, making sure you're training yourself on things like kickbacks and inducements and all those type of abuses. Write disciplinary procedures so that it covers all the staff, and then train all the staff in it. Write your policies against kickbacks and inducements. Write your policies and procedures to log and establish all those paper trails for all the new training and all the new regulations that we have to do. So basically, if you were to do these things, this is going to put you a long ways towards being compliant in what is expected today. There are other things, but this would be a good start.
Don, Dr. Cross, it's amazing all the different pieces out there. It really is. You've got some questions. If you guys have any questions, now's the time. Shoot. Yes. There's okay. So there's some questions coming in that I can answer. Does this apply to you if you're an individual practice with nobody working for you? And if I'm doing this a little bit with Dr. Cross, I can tell you Dr. Cross is unavoidably going to say yes, it does apply to you as well. Dr. Cross, would you agree with that?
Right. If you're doing any type of billing to insurance companies, if you have a computer that you're doing your notes on, yeah, there's all different parts. You may not be required to cover everything if it's just you, but there's certain things that you will be having to take into consideration when you're practicing like that.
And the next question, predictably, is I've got. Suppose I go to a cash practice and do all case fees with people. Does it still apply to me?
If you're taking credit cards to make the payment, to accept payments, there are certain things that will take into consideration and you will be covered under. There might be some things you won't have to worry about, but to say that there's nothing you have to worry about, that's incorrect. They've actually said that if they find somebody trying to not be compliant with these regulations, that they will look at them twice as hard as anybody else because they expect you to be doing fraud and they expect everybody, all providers in the country, to be compliant.
Okay, Dr. Cross, thank you very much. The way that Kyra One Source and Randy over there has put it to me from a business point of view, there's four options as Randy puts it, and Randy is the Kyra One Source implementer of OCCM. You can do nothing, put your head in the sand. You can create your own manuals. You can get OCCM, or in candor, something like it. There's other things out there in the market. Um, but my strong opinion from talking to people that have worked with a lot of them is that OCCM is the most effective way to do it on your own, or get OCCM and have somebody like Randy help you implement it. Randy, as I said before, is the OCCM compliance implementer from Kyra One Services. And Randy, are you on the line?
I'm here, Dr. Weiniger. Can you hear me?
Yeah, I can hear you. You want to talk about these things for a second?
Yeah, I sure do. Because folks, I look at this from a different perspective. The key here is the ability to get this implemented. That's where I come in, and that's how I look at things. In other words, you could have the greatest tool in the world, but if it doesn't get implemented, it really doesn't bring us any value. And Dr. Cross has done a great job of putting a package together that not only satisfies the requirements, but is a tool that is as easy as it can be to get implemented in your practice. And so if you just go through the options, the first one being put your head in the sand. So hopefully the fact that you guys are on this presentation, that is not your intent. And obviously that's going to lead to some pretty serious potential issues going forward. And as Dr. Weiniger mentioned, you can create your own manuals. And folks, you could build your own house and probably build your own car, I guess. If that is an option that would be fun for you, entertaining, I don't know what it would be, but literally going through all the government requirements and learning all the rules, and I'm sure Dr. Cross has spent literally hundreds of hours doing the research to put this package together. And there are other packages out there, but I have worked with the OCCM package that Dr. Cross has put together. It provides all of the tools, the forms, the audits, the outline, the ability to customize that you need to get compliant. Now, you still have to do the work. Obviously, there's putting the information together and documenting, but you have to follow through and actually do things. That being said, this package enables you to do that, and I think it provides the direction and the outline that many practices can do that on their own. So that is my first point. If you have a practice where sometimes you need someone to provide the leadership, direction, hold people accountable to dates, probably take an instruction booklet and turn it into what I call homework assignments. That's where you would consider utilizing me to help get this implemented. So whether you go with 3 or 4, the fact is the tools are here. It is a reasonable investment. In fact, I think it's very, very even underpriced. And as I said, if you have a staff member or yourself and you're good at following through and holding yourself accountable, or you have a staff member that is good at following through and holding themselves accountable, you know, for $495, this is a special price part of the webinar, and we'll show you a number here to call here in a minute. Give us a call, the package will come out. It is customizable, which is really important, but it keeps you from getting in trouble by, I guess, getting outside the box. And then finally, for $697, and that includes the manuals and my personal assistance, you know, I need someone at your practice that is my partner, and we work through this together on your timeline. I've had practices do this in 30 days, and I've had practices take 6 months. The key is that you're moving forward and you're getting to the point of being totally compliant.
Randy, there's a couple of questions that have come in as we're talking. Dr. Cross, I'm gonna field some of these and bounce them to you. One question is there a checklist we can download to audit our own practices? And I believe that's the audit tools on OCCM. Is that correct?
Right, we have that. The OIG also put one out, but it's basically written more for somebody like myself that does this kind of work to go in and look at a practice. But the one that I put together for the package is written so that your regular office manager or a CA can actually do it.
But the audit tools are included in the OCCM manual, but that is something that they can buy separately. That's, I think, $150 or something like that, but it's included in the manual if you only wanted the audit tools to audit your own. One question was, did this apply only to Medicare? I can answer that. This applies to everything. Dr. Cross, would you agree?
Right. They basically, all of the third-party payers, typically, I don't know of any of them really that aren't in some sort of contractual agreement with CMS and Medicare or Medicaid. And so if you provide services to a Blue Cross Blue Shield, to Aetna, whoever, there's going to be, you know, there are requirements for you to be compliant as well. Once this went into effect, 4 days later after it went into effect, I have my first notice from Blue Cross Blue Shield, double checking to make sure that my office was compliant.
Okay, next question was, can we download the slides to review? You'll be getting a follow-up email. We'll let you know on that email. Does somebody need to log records requests from law firms if there's a PI case?
Most definitely. Anytime you send out any information, even if it's to the attorney, it must be encrypted. The only person that you can send information by email that is not encrypted is to the patient themselves, and you have to have a written authorization in your office saying that they said it was okay to do that.
Okay, next question is, how can you tell if your email is encrypted? I can answer that. If you don't know the answer to that, it isn't. The next question you should be asking is, what does that mean? And Dr. Cross, I know this is a longer answer, but this is something that I think is a really good topic of a future webinar. You'll be getting future information both from Posture Practice and ChiroOne's services, and I could see email management being one of those topics. Is Square acceptable for credit card usage? That's a good question. Dr. Cross.
Is what now?
Square. Do you know what Square is? It's a little credit card.
Oh, yes. There's still a lot of discussion going on. NIST, which is the National Institute of Standards of Technology, has specific standards that everything has to meet. I have not seen anybody that's done a really good, thorough evaluation to see whether it meets all those standards. It probably does, but I can't say for sure whether it is or not.
Actually, you know what? In the follow-up, I can't promise you what we're going to get, but Matt, that's a good. I'm sorry, Kenneth, that's a good question. I'm going to follow up with that with some people, and if we can get an answer to that, we'll give that to you guys as well. I make you no promises, but if we can, we can. Someone says they've been working on a compliance manual for 2 years. How do they know if they're doing everything that they're supposed to?
Uh,
Dr. Cross, that one's
Well,
yours.
the way you don't want to find out is when an auditor walks in your front door. There is the full risk assessment that should be done on an annual basis. That if you do the complete, thorough risk assessment for your practice, that should give you a good idea where you're going to still need to do a corrective action plan.
And that risk assessment and the audit tools that's part of the OCCM manual is what would give you the ability to document whether or not you have tapped those bases. And this is my big thing about this manual. It's not just a manual. It's a systematic way to tap the bases and to know where they are and to create an internal system to keep on tapping the bases by having a process. Are there pieces to it? Yes. That's Randy's job. If you want someone to hold your hand going through it, to be your minder going through to help you do it, he's someone to help you do that. If you want to do it on your own, that's what OCCM's about. Randy, any other thing? Any other comments?
No, I think we've covered it. I think I hope the folks have gotten a good overview of just how complex it is. I would just go back to Dr. Cross, your opening comments, and the new compliance issues can be overwhelming. I think that is one of the most understatements I've heard. It is totally overwhelming, and from having helped people implement this, you got to take a hard look at this. The investment is small compared to that risk, and it will help your business. It helps the practice. At the end of the day, you have better procedures. There's no doubt about it.
Randy, thank you very much. Also, for any of our people, any CPAPs or other posture people here, if you want to order this from Chiro One Source or from Body Zone and Posture Practice, either way is fine. Online it's $4.99. For people on the webinar today, through the end of the week, it will be $4.49. You need to call to buy it. I don't believe there's a coupon for it, so give us a call or give Chiro One Source a call if you want it, or if you have any other questions that we can easily answer. Dr. Cross, anything else you'd like to say before we wrap?
I want to remind everybody to make sure you log that you had 45 minutes of compliance training today.
You know what? That's a good point. Where do you write that down? In your training log. Holy smokes, I see what you're talking about. Cecil, thank you very much for having us. Anything that you'd like to say, Dr. Walker?
No, he had to step out, but from Chiro One Source, thanks for Dr. Cross, Dr. Weiniger, and folks for attending. And we will sign out and go help some patients.
Guys, have a great day. God bless.